It is Breast Cancer Awareness Month, a time to raise the collective consciousness, right, of that deadly disease. You may have heard before, it is the second most diagnosed form of cancer among women. So what about the men? So here today to talk about this very real threat of male breast cancer, Dr. Kobbermann with the Sarah Cannon Cancer Institute here in town. Thank you so much for stopping by. Yeah, we don't talk about it very often because it is quite rare, we should say.
It is. It's not a common cancer in men. It's in fact 100 times more common in women, which is why we talk about it quite a bit. But it does happen, and one of the risks with men is it tends to be diagnosed at a later stage because people don't think of breast cancer in men.
Right. You don't think about it. And I know you're on the cutting edge of statistics and everything. Give us the numbers here on how often you hear about it.
So I see about one male breast cancer patient a year in my practice.
Okay, one a year.
Overall in this country, about 2,500 men will be diagnosed with breast cancer a year, and about 500 of those will die from the disease.
All right, because men are going to be very unwilling to go in and say, I think I need a mammogram.
There is a stigma associated with it with
there
men.
Shouldn't be, but there is.
It's kind of a female cancer, and that's sometimes a little bit uncomfortable for men. And a lot of people don't think about it, whether it be the man that kind of identifies a lump or something unusual, but also their doctors a lot of times will think of any number of things that are more common. And so what happens, it tends to be diagnosed at a later stage. So the outcomes are equivalent to that in women, stage for stage, but we tend to find men later in their course of disease.
So let's talk about signs and symptoms. Are they similar to what we are always told?
Very similar, and actually since men have less breast tissue, a lot of times it's easier to feel lumps and bumps.
Really?
So new lumps and bumps are always of a concern. Nipple discharge or bleeding, anything unusual that way, and that's in fact how Beyonce's dad identified his breast cancer.
Thank you for bringing that up, because that was kind of surprising last week. Michael Knowles came out.
Absolutely, it's uncommon, but more and more men are talking about it, which I think is important.
Which is awesome.
And he had a genetic mutation that predisposed him to breast cancer, which is another risk factor that some men will have.
So he likely was a little more, hip to the scene, or
Hopefully.
open to the idea that is possibly could happen to me. Let's talk about those risk factors.
Yeah. So heavy drinking, liver disease, things like that can increase the risk of breast cancer in men. But same thing that we see with women, kind of obesity, sedentary lifestyle, kind of eating a poor diet.
It really is very similar to what we hear.
Absolutely.
Okay, now, excuse this question, but I just had my mammogram last week because it's that time of year. And, you kind of have to squeeze yourself into that little machine. Are men tested the same way?
So we don't do routine screening on men for the most part. If they do meet certain high-risk criteria, then maybe, but their risk is so much lower.
But you do the mammography equipment.
We can do mammograms. So you think of women with small breasts, it's the same way.
Same idea.
So we do mammograms sometimes, ultrasounds if there's a lump, we can do that as well, and certainly clinical exam.
Yeah. Oh, absolutely. Dr. Kobbermann, thank you so much for stopping
by.
It's always a pleasure to chat with you. And if you want to hear more from HCA Midwest Health, you can find more of these helpful segments online. Go to kctv5.com/HCA Midwest. Real men wear pink.
That's true.
So they say. Let's start our